Hey, it's Courier Girl, and let's do another question and answer. So, Brian asks, what do you do for health insurance and is it expensive? So, honestly, this is a question that I get asked a lot, but I have kind of been avoiding answering because I do not fit the mold of what most people do for health insurance. I've been self employed for most of my life, and there were a lot of times that I just didn't have health insurance. So I got really good at fixing almost everything on my own. Having said that, I know not everybody thinks the way that I do, and I know that there are some major health conditions, accidents, diseases, things like that, and you want the peace of mind of knowing that that's going to be covered. You know, you go to the emergency room and it's like $1,200 for a Band-Aid. So I get that healthcare is really, really expensive, way more expensive than it probably should be, and you want to be covered. So, what are your options? I'm going to do my best to help you out here. So, the first option, and the one that very many people take advantage of, is they have a spouse or partner who has health coverage and they're covered under that plan, like a family plan type thing. Or if you're younger, you might still be able to be covered under your parents' plan. I think you can up to a certain age. And that kind of handles the whole health insurance thing. Then you don't have to worry about it. Secondly, there are a lot of retirees who get into the courier business and they might have Medicare plus a supplemental, so they don't have to worry about having traditional health insurance. So that's probably the biggest bulk of people out there. But what if you're single or you don't have a spouse or partner who it has any kind of health coverage? What if you're both couriers? What are you going to do? Well, there are a few options, and I want to go over those. The first one is to check with the company that you are doing the work for or most of the work for. A lot of companies have deals with health insurance companies where you can buy coverage and kind of get a discount because you're part of their umbrella. So if they have that available, then check out that coverage, see what different plans are available, and see what fits into your budget. Now, if you do that, also check outside of their network, just check on your own and you can Google health insurance for the self-employed or something like that. And you might find that their discount isn't such a great deal. Sometimes what I find is they may give me 1% off, but their rates are higher, so I'm still better off going with somebody else. So really shop around and check things out. And what you're looking for is contractor or self-employed health coverage. The other thing to think about is how much health coverage do you need? If you're relatively healthy and you hardly ever go to the doctor, you might be able to get away with a plan that has a higher deductible and therefore lower premiums, or even what's called a catastrophic health insurance plan, which doesn't cover anything unless you have like a major thing happen, like you have to have major surgery or there's a big disease that needs ongoing treatment. Then you're going to be covered for that. But they have high deductibles, sometimes as much as $5,000 or $10,000 a year, but their premiums are a lot lower. So you have to really think about it, write it down, the pros and cons of each different type of plan and figure that out. Okay? The next thing that you can do is look into an HSA or health savings account. Now, I don't know the ins and outs of that. You'll have to check with your tax preparer or CPA because there are tax benefits to doing this. So what that is, it's like a savings account, but you have to set it up has to be like officially set up as an HSA. And you can check with your bank or Google it online and see what kind of banks let you set up that kind of account. And you can put so many dollars into it each year and it becomes a savings account. But then anytime you have a medical bill, you can pay it out of that account. So, and if you don't ever use it, it accumulates year after year after year. That's the way I understand it. And you can eventually use it for other things if you never have to use it for health. So it's kind of like paying yourself for medical bills that might happen down the road. And lots of things are covered. The way I understand it, anything medical related, like even if you need to buy an ace bandage or certain supplements or lots of different things. But again, I'm not an expert on it. I don't know anything about it other than they exist, and I should probably get one, but I haven't yet. Um, so check that out. I do think that tied to that, you also have to have some kind of catastrophic insurance plan. So there will be a monthly premium for that. So that means that your health savings account will cover you for, immediate needs, and maybe can even cover your deductible once it builds up enough for your catastrophic plan. But then you also have that extra layer higher up to cover the really, really big things that hopefully you'll never have to deal with, right? So that's the next option. And the last option that I wanted to talk about is Medicaid. I know a lot of people are like, Medicaid, that's like welfare, right? Well, yes and no. As a courier, you get a mileage deduction. And if you're like me, you drive a lot of miles. So you might make a lot of money, but after your mileage deduction, you actually, for taxable income, may legitimately be at an income level that you can apply for and get Medicaid through your state, which pretty much covers everything. At least in most states it does, I think. And I don't want you to, for me, I have done that in the past. I'm not on it right now, but I have been in the past exactly for that reason. Because, yeah, I was making plenty of money, but with that mileage deduction, which again is 100% legitimate, you're not cheating, you're not doing anything wrong, I was able to have an income that was low enough so that I could qualify for that. So why not? Now, I know there's an emotional component to that, so I wanted to talk about that for a minute. A lot of people are like, oh, I'm never going to take welfare, which is basically what it seems like. But here's how I look at it. Our healthcare is so expensive. We have probably the most expensive healthcare in the world. In fact, it's so expensive that people will travel to other countries to get procedures done. And even with their travel costs and the cost of lodging and the cost of the procedure, you're still saving money over what it would cost here. And I think our system is just really corrupt, and it's not doing us any favors. So if I can get the benefit, for all the money that I've contributed over the years, all of the tax money, all of the hassles I've had to put up with, the outrageous costs, and like I said at the beginning of this video, there's been times I've had to go home and fix myself whatever I went to the doctor to have fixed. So it's not even always the best care. I know I'm ranting a little bit. So I do not any longer feel like there's any reason that I should not take advantage of Medicaid if my income qualifies. And I want you to think about that too. And I don't know what the cutoff is. It's different in every state. So again, check with your tax preparer, check with your CPA, check with your state and see what the qualifications are and see if you qualify. Because if you do, that would solve the whole problem. So the other thing, the final thing I want to say is live the kind of a lifestyle so that you don't need a lot of medical care. There's so much information out there on health. I've been working with a naturopath for the past few years, and that's not covered by insurance, so I'm paying that out of pocket, but I consider it good money because it's keeping me from having to have all of those other bills and all of those other prescriptions and procedures and blah, 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 blah. There's been so many things that we have corrected in my own health, and we continue to keep correcting it. And I think that's money well spent because it's keeping me feeling really great for my age. It's keeping me feeling younger. I'm able to work really long hours without getting overly tired. Just so many benefits. I can't even start, to list them all. But none of that stuff would be covered by insurance anyway. So for me, it's a choice. Do I pay the insurance premium and go down the mainstream medical route, or do I go down the alternative route that I'm seeing good results with and pay for it myself? And what I do, I don't have that health savings account yet. I need to get one, but I have a percentage of my income that I put aside every month, and I kind of call it like my health fund. And so that's like goes into a separate savings account. So I let that accumulate, and so far it's been more than enough to cover what I need it to cover. Now I don't put a lot in, but I also don't have a lot of expenses. So it all works out, and I'm actually ahead right now. So I hope that helps. I hope that answers your question, Brian, and everybody else who wants to know about health insurance. I know it's a really big expense when you're self-employed, and I know it can be really scary to think that you might lose everything because of huge medical bills. I know that is a concern that a lot of people have. So that's it for now. Peace out, and I will see you on the road.